We know that diabetes is at epidemic proportions and is steadily to increase over time. And in addition, heart failure is becoming a common manifestation of diabetics. And, we want to find out how we can better identify diabetics who are at risk for heart failure before they actually get to symptomatic heart failure, because we know that 1 in 5 patients who with diagnosed heart failure will pass in 1 year. So we set out to establish a non-invasive way to help identify patients high risk, such as diabetics and incident heart failure. One is using the NT-proBNP, which is a natriuretic peptide that is released in terms of ventricular wall stress. We know from prior studies that it is used in acute heart failure. However, in patients who are asymptomatic, can this biomarker be used to identify those for incident heart failure? So, in our multi-ethnic study of atherosclerosis, we assayed 5,000 individuals with NT-proBNP and evaluated whether or not these individuals had an association with elevated NT-proBNP levels and incident heart failure. And what we did find in our sample, a multi-ethnic cohort, was that NT-proBNP levels was higher in diabetics compared to non-diabetics. In addition, diabetics had significantly higher heart failure incidence compared to non-diabetics. And when we looked further, individuals with elevated NT-proBNP levels greater than the 75th percentile had significantly elevated heart failure risk. What we did also was look for interaction between diabetes and NT-proBNP, and we did find a significant interaction between NT-proBNP and diabetes. So, our research suggests that NT-proBNP may be a biomarker that's useful to predict for future heart failure in a high-risk group such as heart failure, where currently the guidelines don't have any other measure, whether it be a biomarker or non-invasive such as transthoracic echocardiogram to use in these patients who are still designated as high risk, however, have a future risk of heart failure. We used, in terms of for the 75th percentile, the cutoff was greater than 112, and that's PC per milliliter. And we used, it was the same cutoff in both diabetics and non-diabetics, and which is a cutoff that's much lower than in what we use for acute congestive heart failure.